Good afternoon and welcome to another COVID-19 outbreak in Western New York, particularly Erie County. I'm Erie County Executive Mark Poloncarz coming to you from the Rath Building. I'm joined by our Health Commissioner, Dr. Gail Burstein, and Kendra from Deaf Access Services will be providing the American Sign Language during our presentation. I want to thank everyone once again that is out there for the good work that you're doing to help flatten the curve, keep our contraction rate of the coronavirus down. We are seeing reduced cases with regards to new cases coming in as a percentage of all that we're testing, but we do know that there are individuals who are still contracting the coronavirus and will for the foreseeable future, as well as deaths. And unfortunately, we've had more of those, and we'll have to talk about that in a few minutes. But I do thank those who are following proper social distancing guidelines. And those that are not, this is real, this is not a hoax, I ask you to follow the proper social distancing guidelines too, so that we can all get through this as best as we can. As usual, we have a little proviso just to tell you that everything that's being presented is as was put in the presentation or what we knew as we started this, and it can change. And for the latest information, always go to our COVID-19 webpage at erie.gov/COVID-19. And there's lots of great information on there, including if you're looking for a job, there's nearly 100 employers that we're aware of that are hiring in Erie County alone, and you can get a link to those employers that are hiring if you're looking for a job. COVID data, as of 12 p.m. today, there were 4,161 total positive cases in Erie County. Testing has really ramped up in the last 10 days or so, but especially in this past week. We've now tested more than 23,000 individuals. That was through yesterday, and there was more tests that are being done, of course, today. Unfortunately, 346 people have died. We had a little delay in getting information yesterday, so we didn't report on deaths yesterday, but I did report earlier today with information from the Department of Health that we did have 23 more deaths from what we had as of Wednesday, and I do offer my deepest condolences and true sympathies to those families. We're reading stories about these in the news. We're hearing about these individuals who, many of them were otherwise healthy and unfortunately contracted the coronavirus and have since died. And I offer my deepest sympathies and condolences to the families and friends of all those who've died. These are not presumed cases. These are confirmed cases. These individuals had tested positive before their death. So it is not as a presumed positive, as you may have heard from other places. We are not doing presumed positives here in Erie County. I have no idea what the presumed positive rate is because we don't get that data. We're just talking about actual confirmed cases and confirmed deaths. Now, another thing that's been a little concerning for us the last couple of days, we had not received any hospital data from New York State for the last 2 days' worth of data. So on Wednesday, I presented you the data that was in regards to the day before. Actually, I should go back. Wednesday's data would have been Monday's because there's always a day and a half lag. We have not received any data on Wednesday night or Thursday night. New York State is updating its system. This is not just a county of Erie issue. This is a statewide issue. And so the HERDS data, as they call it, the hospital reporting data system, is being updated. And as a result, we have not received any data of hospitalizations in Erie County for those past 2 days. And so as soon as we get that information, we'll publicize it, but we don't have any hospitalization data, unfortunately, to provide for the last 2 days. Mortality review was performed by our Erie County Department of Health epidemiological staff and others in the Department of Health to try to determine where the deaths are coming from in Erie County. And what we've been able to determine is that 55% of the COVID-19 deaths in Erie County were associated with exposures in nursing homes. 45% of them exposed in private settings. So as we've been saying all along, this is not just something where a person who's living in a nursing home is the most vulnerable. Depending on what your age and the issues you may have, you could be vulnerable if you're living at home. So 55% of the deaths in Erie County are directly attributable to those that were exposed in a nursing home, but 45% of them were not. They could have been exposed in an apartment complex or lived in an apartment complex. They could have lived by themselves in a house. They could have lived in a congregate setting elsewhere. But they, like an assisted living facility, but for those who are saying that this is only nursing homes, and we've been saying with regards to the death data that we know that many people who are contracting the coronavirus are under the age of 60, and we have seen deaths in that category as well. But unfortunately, we know that this is striking our nursing homes very significantly. We're working with the New York State Department of Health with regards to potential outbreaks in nursing homes. We're aware of a significant outbreak at the Absolute Care Center in Aurora, East Aurora. We've received a lot of calls why East Aurora and Aurora's numbers have jumped up. There is not an outbreak in the general population in the town of Aurora, but there is a significant issue at the Absolute Care Center in the village of East Aurora, town of Aurora, and our Department of Health has been in contact with the New York State Department of Health to try to address that issue. And we remind everybody to continue to take precautions, especially amongst those that are most vulnerable due to their age or comorbidity issues that they may have, because you don't have to live in a nursing home to have died from the coronavirus, because there's 45% of the people in Erie County who've perished as a result of contracting the coronavirus. They've died from COVID-19, did not live in a nursing home. So we think it's very important for the public to understand that. Hospitalization data, as you said, we can't give exact hospitalization data for Erie County due to the lack of information from New York State, but there has been a statewide decline in hospitalizations. We have seen, in at least the data we knew of a few days ago, the decline was existing in Erie County. And this chart you see here, this graph is from the University, from Syracuse.com, which is showing the growth and decline of all cases in New York State since the middle part of March, it would appear. And it is noticeable that there has been a drop of hospitalizations across the whole state, and we have seen a drop in hospitalizations in Erie County as well, and we want that to continue, and the best way to continue it is to prevent the further spread of the coronavirus by flattening the curve so that we're not having our hospitals be inundated. We showed this chart on Monday and Wednesday. We'll be updating it again for next week. This is the COVID-19 test reported by week, and you see that there is a drop in the number of individuals who are testing positive with the diagnostic test that we're performing compared to the overall amount that's being tested during that week. Early on, we had nearly 30% of all people that were being tested were testing positive. We had no reason to believe that the 30% rate was an accurate representation of the greater population, but we did understand for those that were first responders, those that are working in a healthcare setting, that they are most at risk, and it did show it in that data. But now that we're testing more people from the general population, that rate has dropped. It was 16% of all tested the week of May 2nd that actually did test positive, and I'm glad to see that number continue to drop. Dr. Burstein, would you like to talk a little bit about your thoughts on this as well?
So we're really excited that the community has gone out and gotten tested. We have expanded our capacity in the community for people to get tested. So anybody who feels that they may be at risk of COVID-19, maybe they've been exposed and they know it, maybe they have symptoms or some reason, you don't have to share it with us. Start with us, you are able to get to test. And again, one of the governor's milestones that we have to reach is getting a higher level of testing done in our community. And so we really appreciate Erie County residents stepping up and getting a test. And it's great that the proportion of positive tests are going down. That means that we're doing a great job on social distancing, and we have to keep those numbers down.
Thank you, Doctor. To sort of talk about the thing I just was referring to, that those with regards to the deaths of those who've contracted the coronavirus, we do know, and this has been the normal for quite some time now, that approximately 75% of all individuals who perished as a result of the coronavirus are over the age of 70, or 70 and older, I should say. So this definitely has a tremendous impact on the population in general. And if you will note, males make up about 51% of the individuals who are dying, females 49%. So we continue to track that. We've seen some data lately that shows that more females are dying in the 80 and over category that contract the coronavirus. It also happens to do that females, I think, live longer than males in general. But you do not have to be a senior or in a nursing home to contract the coronavirus and die from it. As we said, 45% of the individuals, the 346 fatalities, lived outside of a nursing home. And so it is very concerning to us to get that message out that just because you don't live in a nursing home means that you're immune from contracting or getting seriously ill or dying from the coronavirus. We have seen that throughout. And as you see, there are individuals in their 30s and 40s who've unfortunately perished from this. And every death is one death too many. So we're hoping to keep that number down. And the best way to do that is to prevent the further spread of the coronavirus. And this chart here goes to show just by age range, once again, in the gender breakdown, that at 80 and above, there's 104 females that perished as compared to 79 males. And once again, I'm just offering a anecdotal view for myself. It may just as well be because there are more females that live longer than males, because you see in every other age category, it is males that surpass females, exceed females in the percentage of deaths in that age category. So we keep track of this information and let the public know because it is something that is very important for them to know, and that is you don't have to be a senior in a nursing home to perish from COVID-19. We've all seen stories nationally about that, and we have stories in our own backyard of individuals who were otherwise healthy in their 40s or 50s who unfortunately contracted the coronavirus and died from it. The mortality data with regards to race and ethnicity, as of this morning, the 346 that have died. People of color, African Americans, make up 19% of those who've perished from the coronavirus. We do know that's a little higher by about 4.5% from what is the actual percentage of African Americans in Erie County. So we're still watching that, but that number thankfully has gone down from where it was earlier. Latinos still make up only 1.7% of the fatalities, even though they make up a larger portion of the population, greater than 5% of all of Erie County's population. And you can see once again that males have exceeded females 176 to 170 in the age categories. Our response, of course, we have a tremendous response. We've had it for weeks now, and it keeps on growing. And the big response that we have is regards to testing, and I'll turn it over to Doc Burstein to go through the upcoming Dr. Burstein, my mother's going to yell at me again, Dr. Burstein, with regards to the COVID-19 testing that is going on, both diagnostic and antibody.
Thank you, Mark. So some people might be a little bit confused because they hear that there's, diagnostic testing with a nose swab, and then there could be antibody testing, and people trying to figure out, well, which is the right thing for me. First of all, the answer to that in general, if you have a primary care doc, it's really important that you talk to your primary care doc and sort out which test is right for you. So the difference between a diagnostic test and an antibody test is looking for when you are infected with COVID-19. So a diagnostic test will tell you at the time when you had the sample collected, and that's mostly with a nose swab or nasal swab, if the test is positive, it will tell you you had an active COVID-19 infection at that time. And you're probably shedding virus, and you're probably likely to infect other people, and that's why it's really important that we put you in isolation, you stay away from other people to break that chain of transmission. This test is looking for the virus DNA or RNA, and it's looking to see if you're actively shedding a virus in your nose. As opposed to the antibody test that is telling you that if somebody who has a positive antibody test, that you had sometime in the past been exposed, and you're probably infected, and your body mounted an antibody response that the test is detecting. So these tests are different they're collected differently. With the diagnostic test, you need a nose swab. With the antibody testing, most of the tests available on the market, you have to get your blood drawn with a needle. And then it doesn't mean that you're actively infected at all. It just means that you had an infection in the past. It doesn't mean that you're immune, and it doesn't mean that you're protected from another infection. We know that there are other infections that you can get multiple times. We've all had more than one strep throat infection in our lives. People get influenza every year because the virus mutates. So we don't know what happens with COVID-19. So just because you have antibodies doesn't mean you're protected. Also, there are a lot of tests on the market now, and they're not all FDA approved, so there can be tests that produce false positives, so the result is positive and you really don't have antibodies, or false negatives, so the result is negatives and you really do have antibodies. So you want to try to make sure that you go to a lab that has an FDA approved test, so you know it performs well. Thanks. So if you want to get testing, there are a lot of places to get testing right now for the nose swab, which is telling you that you have an active infection and that you need to be isolated so you won't infect other people in the community. So at Erie County Health Department, you can call our hotline at 716-858-2929. And we will test anybody who believes that they're at risk, whether they can tell us if they've been exposed, whether they have symptoms or not. For this test, you don't need a doctor's referral. If you have a doctor, you should limp them in and try to get a lab order for that. And these are by appointment only, so that's why we ask you to schedule. So since there's an increased demand for testing, we've heard you, and we're expanding our testing capacity to 5 days a week. And we're going to all different locations throughout the county. So give us a call, and I'm sure that there will be a testing location near you that you can get a nose swab to see if you have an active infection. Also, we've heard that for people who wear English as a second language or don't speak English, it's a little bit tough, so we do have foreign language interpretation available. We just want to make it easy for people. So also our great partners at Kaleida Health, they also have testing sites throughout the community, especially in downtown Buffalo, they're really hard trying to make testing accessible for people in the city of Buffalo. They've opened up one particular site at the Leroy R. Coles Junior Library on East Delavan Avenue, and that's open Monday, Wednesday, and Friday from 9 to 5 for people that have COVID-19 symptoms or for people that don't have COVID-19 symptoms. It's by appointment only. If people have a healthcare provider, they should loop their provider in and get a lab order. And I just have to, help people understand it's really important that if you get any laboratory you test and you have a primary care provider, that you go through your primary care provider. They are your medical home. They are going to take care of you. If you have a positive test result, they're going to make sure that you're doing the right thing to take care of yourself. So it shouldn't be viewed as a hassle. It should be viewed as something that you're doing to take care of yourself. And then you can go through Kaleida's website and then find their phone number or go online.
And if I can note, I actually stopped off at that facility today. Thank the staff and others for the work they're doing. As we noted, it's by appointment only. You will drive in, you will be undercover, you will drive out, but that's not the only site that Kaleida is doing testing at. They have another site at Best Street in Buffalo, and I believe they have a third site as well. So if you are looking to get tested, you can contact Kaleida Health, you can contact the Erie County Department of Health, and as the doc will talk about now, doctor, oh boy, my mother's really going to yell at me, the New York State Department of Health is also doing testing in downtown Buffalo.
Thank you, yes. So they are collecting specimens against the nose swab for people who are close contacts to a positive case of COVID-19, for regardless of symptoms, for any healthcare worker, nursing home employees, first responders on the front line, or any essential employees that interact with the public. They are willing to test you. This is, again, it's by appointment only. Again, it's one of these situations like the other ones that I've named, that there's no out-of-pocket costs. So you can call the COVID-19 hotline at the state or go on to their website that's on the screen and make an appointment for you. It's on Perry Street in the Cobblestone District of Buffalo. And so I just want to explain isolation orders, because remember, the reason that we want people to get tested is so we can identify that they're infected, remove them from the community to try to break that chain of transmission, to bring our numbers down and make everybody safer. So who is subject to these commissioner's orders? So people that have symptoms of COVID-19, when they get their specimen collected, when they have their nose swab, they should be at isolation when the time they have their specimen collected, because they could be sick. They have symptoms of COVID-19, and there's a good chance they should be sick. Or they could be sick with COVID-19, or they could be sick with something else. So they should be in isolation away from the community. Also, people that have don't have symptoms, regardless of symptoms, who have a positive test for COVID-19, that means that they are ill with COVID-19 even though they feel well, and then they can't transmit infection to others, so they should be in isolation too. So those isolation orders apply to them. So people who do not need to be in isolation orders are people that don't have any symptoms, so they get testing while they're waiting to get the test. They don't have symptoms, they don't have to be in isolation, so don't be afraid to get a test if you don't have symptoms. We're not gonna put you in isolation. And then anybody about during that time when you're waiting for results, if you do develop symptoms of COVID-19, you should put yourself in isolation, and we will call you if you are positive and make sure that you understand what that is and how you can release yourself.
Thank you, Doctor. We have included in the presentation today information from our medical examiner's office on suicides. You've heard us talk about, if you're in crisis, call the number, the hotline. We wanted people to understand where we are, and thankfully the data does not show that we have seen an appreciable increase in suicides. This is hard data from the medical examiner's office for the first 4 months of the year, dating back to 2017, and then the full year's data dating back to 2017. So as you can see on the screen, while there's been an uptick from last year in 2018 for suspected suicides that were examined, investigated by the medical examiner's office, it actually is still a little lower than 2017, and it's kind of within the average data as you look back on a 10-year period. So this is something we're keeping track of. We know there's a lot of stress out there, and we were hopeful that this number would not have been higher, and it thankfully has not been higher than what we might have expected, though unfortunately individuals have taken their lives. You see at 33 for January, April, and then we have 36 for January to December. That means just in this first, and this is through yesterday, the first week of May, there were 3 individuals in Erie County that we're aware of that committed suicide. So if you are in stress, if you are in crisis, and you feel there's no hope, please know that hope is available. Hope is always available. Call 834-3131 to talk to someone who will let you know that a brighter future does exist. Don't take the final act. You may think it's the best thing. It will destroy everyone around you. Don't do that. And hope is available for a much better life in the future. Call our crisis hotline at 834-3131, and you can find out very soon thereafter that a brighter, better future does exist for you. Our business task force continues to chug along, and we have a new thing on the screen here, which is a link for vendors to purchase equipment, the equipment that is needed every day, masks, gloves, gowns. Our Department of Emergency Services and Homeland Security, as well as the Department of Public Works and our purchasing office, have been working very hard these last few weeks acquiring PPEs, personal protective equipment, for our first responders and people in hospitals as well as Erie County employees. And we've been able to develop a list of approved, let's not say approved, let's say vendors that we trust, who we believe can get actual PPEs for you. As you may have heard, this was very difficult for us to acquire, but now we know that there are a number of vendors available for masks, gloves, gowns, even face shields, and there's a lot of employers that need to provide these to their employees, especially as we think about reopening. So you can go to erie.gov/COVID-19/PPE vendors, VENDORS, to see a list of individuals, companies, almost all of them that are based in Erie County, and the rest of them based in Western New York, that we believe are real vendors that can get PPE. So if you are looking to get some as an employer, you go to that list and you'll be able to find the vendors that we believe will be able to meet your demand. Our Erie Grown site, which is the resource hub for farmers and others, has been very popular. We've seen a lot of hits to it, and we want people to go there so you can find the closest farmer to you to buy farm products or farmers markets, specialized farm stores. So go to erie.gov/ErieGrown, excuse me, ErieGrown, to get and see a list of all the area farmers and the produce that is available right now. And there is produce available now. Yes, it's May and it's snowing out, but our farmers have greenhouses and they're selling their grown product right here from Erie County. So check it out at Erie Grown. Our business relief program at the ECIDA, I talked on Wednesday how we were very surprised at how few businesses have actually reached out to the ECIDA. A few more have reached out since then. But we want businesses to know there are a number of programs that are available through the ECIDA, including loan programs. So call 856-6525 to speak to a representative from the Erie County Industrial Development Agency who can help you. The Buffalo Niagara Partnership has a business link to put businesses together so they can help connect themselves, so they can sell their products, they can sell services that you may need. So please go to the Buffalo Niagara Partnership at the link you see on the screen, which is thepartnership.org/business link. And then finally, SBA loan program. We know the SBA has been inundated once again with loan applications, but the local office is open to answer your questions. Don't call the 1-800 number. If possible, call the local number, which is the 716 area code 551-4301. Once again, that's 716-551-4301. And once again, where to find PPE, our preferred vendor list for businesses is on our page. I gave you the link earlier, and you can also find it on our COVID-19/business page. And the list will be updated as we find vendors that are available to deliver product. We're not interested in vendors that say they can get it but can't get it for months. We're actually interested in producers and other vendors who can actually deliver the product, which has been very difficult to get, but we have found a number of them, and that list will be updated daily as we get more information. First responder PPE distribution. There's just a tremendous amount of distribution that's been going on through our warehouse, through other parties to get packets of gloves, eye protection, shield, face masks, sanitizers to the 108 fire and EMS agencies and 31 law enforcement agencies across Erie County. When we've been acquiring PPEs, it's not just for hospitals and nursing homes, it's also for our first responders and others, and that makes it a tremendous operation. So first off, I want to thank the people at our warehouse from the Department of Homeland Security, Emergency Services, Public Works, Department of Health, Department of Purchasing, who really, it's a huge operation to the point where we have a secondary location now where we're storing equipment to transfer out. It is one of the biggest logistics operations that we've ever seen in Erie County. The tracking of the PPE as it comes in, whether it comes in from being acquired by Erie County or from New York State, and then tracking of it going out to ensure it goes to the right hands of the individuals. They're just not walking up and saying, give me gloves, give me face shields. They have to put requests in. Then it's apportioned out based on the requests. So I want to thank all the staff from Homeland Security, Emergency Services, Public Works, Department of Health, and Department of Purchasing. And there are some others as well from other departments that have been helping out to ensure that the PPE gets into the right hands of those who need it. And that's been a Herculean operation, but they've done a great job, and I want to thank them for that. Mother's Day is coming up, so we do want to wish everyone a happy Mother's Day to all the moms out there. We also want to remind you to use safe social distancing. With regards to Mother's Day, you may have the coronavirus and not know it. You could be an asymptomatic transmitter. You do not want to give your mother the worst gift she could possibly get on Mother's Day, which is the coronavirus. So please follow safe social distancing guidelines and practices. I wish a very happy Mother's Day soon to my mother, Jan Polenkars. I wish a very happy Mother's Day to all the moms out there, including Dr. Gail Burstein, and I know she wants to talk about this subject too.
Thank you. Yeah, so everybody, it's important that you give a big shout out to your mom and through a social distancing strategy. So in our house, we are going to have a Zoom brunch at 11 o'clock. That is my son, the techie, is going to host it. And so we'll have my parents, my sisters that live out of town, my first cousins that live out of town, aunts and uncles. So it'll be a great party that we otherwise wouldn't be able to have in person. So again, you can call your mom, you can go outside her window, knock on the door, like leave her some baked goods or a little gift. Lots of things to be innovative. So we all have some downtime. Today's kind of snowy, so it's not even good to go outside. So we can use that time to productively think about how we are going to surprise our mothers with a good social distancing strategy. So happy Mother's Day. Happy Mother's Day to my mom and all moms.
Unknown to most of you, Dr. Burstein is an excellent baker. She's notorious for occasionally bringing in a very good pecan pie and other pies. And our deputy county executive, Maria White, is an award-winning baker. And so we've had contests here. I'm not going to tell you whose pie is better because both their pies are excellent. But do you have a recommendation on a particular baked good that you'd like to make? Does you think it would be good for moms out there, Doctor?
Yeah, there's well, if you can get, there's still a lot of apples out there. We've been making apple blueberry pies and also crisp with rhubarb. So those are some ideas that we've been cooking on this week.
Thank you, Doctor. It sounds very tasty. Looking forward to one of those soon, coming to the 16th floor of the Rath Building.
What?
But I want to. She's got
That's
too.
not part of my job
She's got
description.
too much to do. She has too much to do. But so with that, I think we can open it up to questions and answers now from the media, and we'll start. I believe we started at the top last time, so we'll start from the bottom. Is Western New York Media? When I say bottom, I mean bottom of my list, not your ranking with regards to media. But Western New York Media, is anyone on? If not, WKBW TV, Ashley Rowe.
Hi, Mark. Yeah, this is actually a question about the Buffalo Bills season, specifically just about what your thoughts are. Dr. Fauci has said that the virus is inevitably coming back. So do you have any concerns about fans going to the game, since that is potentially a likelihood? And then just a second part of this question, also, if there is a delayed start to the season, what would that mean for the county?
Yeah, I am very concerned, and I've had conversations with representatives of the Bills, conversation yesterday. Just because they announced the season schedule doesn't mean there actually will be fans in those stands. I don't know. And there could be a limit on fans by a percentage of individuals, but even if you did it 25% of the fans, that's still roughly 20,000 people when you include the other folks that need to be in the stadium for a football game. This is all new. We don't know, and I don't think we're going to know probably until August. I don't think we're really going to have a good idea until August. I don't know what their plans are for the preseason. Preseason often starts with the training camp in July. So they can, and the Bills are very concerned. They are exceptionally concerned about this. And their statement to myself, as well as their statement to other members of our staff, is they're going to follow the guide from state and local resources. They're not going to just do it on their own. And we're never going to put the public in a situation where they're at risk. So when it comes
to... Are you working collectively, I'm sorry, Mark, are you working collaboratively with the Bills on a contingency plan?
Well, they're working with the NFL, but I think you have to remember the most important thing that we can do is save lives. I mean, I think we all want to see this football season. The Bills have a great team, but that is not the number one priority of the Erie County Department of Health and my office right now. And the Bills agreed. They realize the number one priority is getting through this crisis to try to reopen business. I would highly doubt that you're going to see a packed house at the stadium this year. If any fans are allowed, I imagine it's going to be at a percentage of the overall capacity. But if people are expecting there to be football games with 72,000 screaming fans in the crowd, it's probably not going to happen. But we're just going to, well, that decision in all likelihood won't be made until July or August. Next question to WIVB-TV, Marley Tuskus, and I believe Dan Telvach's there as well.
It'll be me first. This is for the health commissioner.
Okay.
We've been writing about the septic tank situation, and one of the questions I have is why is it okay for the private inspectors to go out and do this job if the county's not going to go out and do it? What's the reasoning there?
Well, we are doing the job. It's a big job. We have about 530 open or pending property transfers applications. And first of all, in the winter, nobody does property transfers inspections. That usually opens up in the spring. This year, because of the COVID-19 epidemic and because of the New York pause, we had to push that start date back to April. However, we have developed a plan. We are able to do septic system inspections for property transfers on properties that are on public water and have a system on file. And we figured out how to do that working with our homeowners so that we don't have to go inside their house, we don't have to expose anybody to the home, and people in the home don't have to get exposed to our sanitarians. So we make a plan in advance. We contact them, tell them what they have to do, and then we do the outside inspection, and that's been going well. We've done over 50 inspections in the past 2 weeks, and we're still continuing to go. And we are developing a plan for properties that are on private water systems, because that entails going into the house. So we have to figure out how we're going to work that. Again, looking at the community, at community resources, if people are able to get a private inspector to do the work for them, then we really welcome that. We want to get as many done as possible, and we're actually waiving the $150 fee that we usually charge to review that inspection report. So we're doing everything we can, under the given circumstances, to make sure that the inspections take place, making sure that people can get their property transferred and sold, and everything's good. So, again, it's a really difficult situation for everybody, and we're doing the best we can and thinking out of the box how we can pull different resources in the community to do that. So thanks.
Can you talk a little bit about what plan you're thinking about for the people that are not on public water? Is it maybe fully reimbursing them for the private inspector? Does it run anywhere from $500, $600, $700?
Well, we have not finalized that plan yet. Actually, 75% of the inspections that we have pending are meet our criteria that are on public water, and they have symptoms on file. So really, most of the properties that are in the queue are able to go through this mechanism. So we're figuring out what we can do to help those other properties, and we will figure it out. We figured out other tough problems in the past. So we will let you know when we've figured it out. So thanks.
Okay,
Thanks.
Thank you, Doctor. Happy Mother's Day.
Thank you.
WGRZ TV, is anyone there?
Yeah, Steve Brown's on the call. Thank you for the opportunity. I appreciate that the hospitalization data does look like it's trending in the right direction, minus the last few days worth of data that you've noted. And this is kind of taking a look ahead at what could be the reopening of the area. Do either of you think that the concentration of both cases and fatal cases on nursing homes should factor in favor of the reopening because of the limited physical space where so many of these cases are taking place?
Yes, we've had conversations with the state. I've had conversations with the lieutenant governor. I've had conversations with the governor's staff about that. In the end, it's the governor himself who will make the determination as to whether or not a region will open. We will present the data to them, but we do believe that, considering 55% of the deaths are nursing home residents, that should be at least a part of the consideration. And we also have to understand that just because they lived in a nursing home doesn't mean that you just say, oh, they lived in a nursing home, we don't worry about them. We certainly worry about them. So we want to continue to act appropriately to protect residents no matter where they may be, whether it's their own home or whether it's a nursing home. But it is something that we are, the information is being shared with New York State, and we hope that they would take that in consideration when the time is made, or the decision is made, to reopen Western New York. And I'll note for the record, yesterday I convened a conference call with the leaders of Niagara, Chautauqua, Allegheny, and Cattaraugus counties, which are part of the Western New York Regional Economic Development Council zone. So we had Chairwoman Rebecca Whittish from Niagara County, P.J. Wendell, the county executive of Chautauqua County, the Chairman Van Rensselaer from Cattaraugus, and Chairman Kirk Crandall from Allegheny. We had a very good call talking about what we all need to do to try to meet the standards of reopening, and Lieutenant Governor Kathy Hochul was on that call as well. So I think we all know where we need to go, and we're going to share appropriate data with New York State to show that it's time to reopen or it's not. But we are certainly concerned about the number of deaths we've had in nursing homes, and it may be skewing our numbers slightly, but we also have to remember that was a life. And sometimes people are in nursing homes not because they're just old and frail, but because they may have just came back from a surgery. They could be rehabilitating in a nursing home. So it's not necessarily just a young person, but if you are rehabilitating in a nursing home after a major surgery, such as having, let's say, a hip replacement, and you catch the coronavirus, your death is just as important as the person who was 90-year-old and frail. I mean, every death matters, every life matters. So I just want to remind everybody that while the numbers with percentages in nursing homes are higher as a percentage of overall deaths, that just does not in itself mean that any of those lives are less important. They are all important. Mike Mroziak, WBFO. Michael, are you there? Unmute your phone. Did you leave? If not, we'll go to Mike. You still there, Michael? Whoa, you're really bad. Why don't we go to Mike Baggerman from BEN, and if Mike Mroziak could call back in, we'll get you back. Why don't you disconnect and try calling back in? So Mike Baggerman.
Hey, Mark. Mike Baggerman here. The last hospitalization data that you guys had was 222 on May 4th, and I understand that is a general decline that you've seen from where the peak was, say, a week and a half ago or so. But in recent days, the total new cases that have been coming up have been about 200 at a time, it seems, on some days that have been coming through. Is it reasonable to think that hospitalizations will increase notably again in the coming weeks?
They may, but I'll turn it over to Dr. Burstein to answer that question more.
We anticipate as more cases that are identified, we may see more hospitalizations. I mean, that's, something that we have to try to be prepared for. We'll have to see. I mean, I think the nursing homes, which we know are a big source of hospitalizations, they're trying to be proactive. They're working with the state health department to make sure that all the residents are tested, and then they can cohort all the residents that are infected with COVID-19 and aren't sick enough to be in the hospital into one place. So to reduce the chain of transmission within the nursing home, they're also swabbing their workers to make sure that there isn't any spread of transmission through the workers. We think that the more testing that is being done in the community will identify people and hopefully break the chain of transmission. Remember, not everybody who has a positive test has symptoms or ends up in the hospital. That's why we're trying to be really aggressive about getting people in to get tested, even if they don't have symptoms, so we can identify them and break the chain of transmission. So, we'll see what happens with our hospitalization, but we're hoping with the more testing done, the more people identified, put in isolation, breaking the chain of transmission will ultimately decrease our numbers. Remember, the proportion of positive tests are going down, and so we're hoping that that will translate into a lowering in the number of hospital admissions. I mean, that's one of the strategies that the CDC is recommending.
Thank you. Michael Mroziak, are you back on? Guess not. Sarah from Spectrum News.
So still sticking with nursing homes, has the state contacted Erie County asking the health department to do the testing at the Erie County nursing homes? Who's in charge of that testing, state or county?
The state is my understanding. Dr. Burstein's been in contact with them.
Right. We check in with them when we see evidence of an outbreak from our New York State surveillance data in our nursing home. We check in with the nursing home, the person in the state health department that coordinates nursing homes care in our area, and frankly, they're usually aware of it before we are. They get the data before we do, and they're usually on it. We offer to help them, and sometimes we provide them with some supplies if they need it. They have an army of nurses that they're going in there and swabbing residents and swabbing staff, and so they have a strategy for investigation and isolation within those nursing homes. So, again, if you have questions about how the state health department is handling that, I suggest that you contact them.
Thank you.
Sandra Tan from the Buffalo News.
Yes, thanks. In regard to also following up on nursing homes, I know that the inspectors were supposed to be visiting different nursing homes each day. I'm wondering if the East Aurora nursing home is one that they have been to, and I'm also wondering if you can tell me which other nursing homes they visited and if you have any additional information about what they found so far.
I can't say exactly which every single one they went to. We do know that the residents and staff at the Aurora I should say, Absolute Care Aurora have been tested, and we do have results with regards to those, and the individuals that are positive, our Department of Health is monitoring and doing contact tracing with, which if they're a resident, they're sitting at their nursing home, but if they're a staff member, then of course that's very important. In all likelihood, almost every one of these outbreaks that came in a nursing home came from a staff member, because there was no visitation in nursing homes for almost 2 months now, so we know it's probably from a staff member that brought it in. And there are staff members that are testing positive. Dr. Burstein could talk a little bit more about it, but we do know that, every resident at the Absolute Care in Aurora has been tested.
Right, so the state has a strategy, a plan to test all the residents and workers in the nursing homes in our area, and so they're trying to go into a different nursing home every day to get done 6 nursing homes per week. So to get their schedule and their approach, I recommend that you contact the New York State Department of Health. Again, it's their strategy, it's their plan, and they know what they're doing. They don't really inform us in advance about that.
Yeah, we'll learn about the results when they come in, but we won't know who they're going to next.
And the nursing homes have been reporting to the state both confirmed and suspected COVID-19 deaths. But are the numbers that you guys are reporting in terms of the 55% overall deaths coming from nursing homes, are those just confirmed cases? I mean, is it possible that could actually have been more?
That is just confirmed cases, and there is a possibility that an individual could have perished from COVID-19 that they did not have a positive test on. It would not have fallen in our statistics.
Okay, thanks.
Buffalo Business First? If not, B News, Ethan Powers.
Hey, Mark, hope all is well. Quick question for Dr. Burstein in regard to remdesivir, the antiviral drug. Doctor, I'm sure you've seen there's been a little bit of controversy over how the drug has been allocated to hospitals. Seems some hospitals with lower case numbers have received the drug, while others that need it can't seem to get shipments. Is this a drug or a treatment option that patients here in Erie County have access to? Do you have any thoughts on it as a potential treatment method?
Again, this is, I think, something that is, still being used for very ill patients, and so you really have to contact the hospitals about their access to this medication.
Okay, great, thanks.
It's generally the hospitals. I mean, we're not prescribing particular treatments. It's the hospitals that do it, and we don't really know in any one day what are the treatments that are being utilized at area hospitals. And because there are different hospital groups, I'd suggest you do contact each of the hospital groups to see what they're doing. I know we had Buffalo Healthy Living and Annette Pinder on. Are you still on? Do you have a question? If not, we'll go back to Western New York Media. Anybody on from Western New York Media? WKBW, Ashley, do you still have a question?
Yeah, just have one question. We've got a few viewers who have been calling in asking us, they've got summer weddings, and they're wondering what you, Mark, and Dr. Burstein think about whether they should be rescheduling or modifying, or if they should just hang tight for now.
I'm in the middle of a conference call.
I really wish I could give them a definitive answer. We have modeling, of course, that shows the coronavirus not really growing as a percentage of hospitalizations in our community, but hospitalizations continuing. So we will still see the coronavirus in all likelihood in our community for the time forward. I do know of a number of individuals who've canceled their weddings, maybe are still getting married, but they're not doing the big wedding ceremony like they were, especially the ones that were all scheduled for May. It's a very difficult decision. I wish I could give people a definitive answer, but the only thing I can say is, from my point of view and what I've seen with regards to the scientific data, is we're going to be dealing with the coronavirus for the next year and a half. In what form, I don't know, but we will be dealing with it for quite some time. Dr. Burstein, would you like to add anything?
Yeah, thanks, Mark. So we know that social gatherings are still a huge risk factor for COVID-19 transmission, and we also know that it's really the governor is dictating about how we are going to be able to open up with New York pause. So it's going to be very, very slow, and in Western New York, we haven't even reached phase 1 yet. So, and we have no idea when we will reach phase 4, and again, recreations and and gatherings will be the last to open up, and even those will still have restrictions on it. So really, people have to really think about that, keep that in mind, and think about some alternative strategies to bring people together in a virtual manner to celebrate, because we are still able to celebrate virtually.
Thank you. WIVB-TV, I know Marley and Dan were on. Do either of you have a still question?
Yes, thank you, County Executive. I just have a quick follow-up question about the Absolute Care in Aurora. I know that you said that the health department is working with them about this. I'm wondering what exactly they have told you at this point, what you guys are doing in order to get the numbers down, if you're concerned about this increase, understandably, that sort of thing.
Well, when I say the health department is working on it, is primarily the New York State Department of Health that is involved in the direct response. The New York State Department of Health is informing the Erie County Department of Health on what is going on there, as well as what they may need. I'll turn it more over to the doctor, but the direct response to any nursing home outbreak is done by the New York State Department of Health, because they are the ones that have primary responsibility for managing and monitoring nursing homes. Dr. Burstein?
Sure. I mean, again, a general response to nursing home outbreaks is to, identify people who are the residents and caretakers that are working in the nursing home who could be positive, whether they have symptoms or not. And then if the residents, cohort them into one area, and then the workers make sure that they're in isolation, they're not back to work for 2 weeks' time. And it's, really, if you want to get the details of how the state's approach, I really suggest that you talk to them. But that's kind of the general approach that I think that is taken to nursing home outbreaks.
Thank you.
Thank you.
WGRZ, Steve Brown, do you still on? Still have a question?
Yeah, I got a clarification question about how COVID fatalities, in regards to nursing homes, are counted. If a resident from a nursing home is transferred to a hospital and passes away there, are they still counted by the county as a nursing home resident?
The analysis that was done by the Erie County Department of Health was the individual's residence when they acquired the illness. So, I mean, if that's the case, almost 100% of all deaths in Erie County would be hospital deaths. They would have not been nursing homes, because while there's a small handful of individuals who've perished in their home, and there are some that have perished in hospitals, the vast majority of deaths have actually occurred in a hospital. So it's not where they died, it's basically where they came from before they went to the hospital.
So the belief is that 55% of all of those that have passed away from a COVID-related illness acquired this virus while living in a facility.
Correct.
Thank you.
You're welcome. Michael Mroziak, I think you're back on. If not, I have a question here from you. Mike, it's pretty rough.
I did send a question in writing. Why don't I just read it? Sorry about that.
Okay, his question was, have other county executives expressed similar hope of a phase 1 start in June? And the answer is yes. Other county executives across upstate New York have. I believe my partners down in Long Island, County Executive Curran, in Nassau County and Boulogne, are a little questioning whether they'll be able to start on June 1. But we do know that a number of my fellow county executives, whether it's P.J. Wendell in Chautauqua, who's in the New York region, Adam Bello in Monroe County, where Rochester is, Tony Pacenti in Oneida, Utica, Mark Molinaro, Dutchess County, Pat Ryan in Ulster. They are all hopeful that those regions will be able to open, some of them May 15th, all of them by June 1st. We are very hopeful that Western New York region will open June 1st. We think we have statistical data which will show that we're capable of doing that. And if things went really well, I'd love to be able to say that we're going to open for phase 1 on May 15th, but I just don't think we're there yet. And once we get the hospitalization data that we've been missing for the last few days, that'll help us also. We've really ramped up our testing. We believe that we know we can meet. Let me say that backtrack. It's not that we believe. We know we can meet the testing requirements, which are basically about 27,000 people tested in a month. If we continue to test at the rate we're testing now, we will meet that of 30 residents for every 1,000. So we do know we can meet that if we get people to come and get tested. So I feel that there's a very good chance that we will at least move into phase one by June 1st. It's possible that it could be the 15th. It's possible it could be the week after. But the key is that I think all of us in upstate New York know we're in a much better position than our friends down on Long Island. I know Dan McCoy feels like that the same way in Albany County. It's going to be it's a lot of work for many people to get to that point. We've all been working very hard. But the biggest thing that we can do is, as a public, still continue to follow proper social distancing guidelines so we can stop the spread of the coronavirus, and then we would have less hospitalizations. Mike Baggerman, WBEN.
Hey, Mark, in the world of landscaping, there seems to be a lot of, confusion about what's going on there. I know you tweeted about it earlier. You know, one of the things in particular is about mulching, whether or not if you put mulch over new mulch, or rather if you put new mulch over old mulch, is that considered a new project or is it upkeeping? I guess what's your understanding of some of the new guidances from the state?
Well, I mean, for the longest time we were told you could do no new work, which included mulching. Then we were receiving information that, including through the New York State Association of Counties, that mulching, as long as they were not doing new plantings and work like that, was allowed. If it was basically maintaining older beds, mulch was considered okay if it was maintaining an older bed. So I announced that, yes, you could do that. But we also know New York State is sometimes changing their minds. As of right now, I've gone under the impression that it is okay to mulch older beds. It's not okay to start building new beds and putting new plantings in. That is not okay under New York State guidelines. So for now, we're not going to penalize any landscaper that mulches older beds. And if New York State decides to change its mind, then we'll let the public know. And they do that a lot. Sarah from Spectrum News, any more questions?
Just one more for Dr. Burstein, the science piece, so it may not. We'll see. So how rare would it be to have antibodies against the virus, and then those antibodies give you very little protection or no protection?
That's a great question, and we don't know that yet. So the challenge with measuring antibodies and having a positive test is that we don't really know what that means in terms of being able to avoid getting a repeat infection. So we've heard data from Southeast Asia that suggests that this can occur. So we'll really have to wait for time to pass to see if people who had an initial infection and had an antibodies response detected do develop a repeat infection. You know, time will tell. And there are other infections that we commonly get where we may have antibodies and we get a repeat infection, like we've all had strep throat more than once. The influenza can mutate every season, so we're always at risk of that. So we'll just have to see. Time will tell us if an antibodies does mean that we are protected or not. Right now, we do not know.
Thank you. Sandra Tan from the Buffalo News, do you have any more questions?
Yes, based on the latest death data, is Erie County still on the 14-day decline for hospital deaths? I'm also interested to know, when you do finally get the hospitalization data from the state, if you could hopefully put that in some context in terms of where we're trending toward meeting the state's criteria for reopening.
Well, we have to get the state data to find out the deaths because it's based on deaths in hospitals. I think as a rolling average, we have declined. We had a couple days where we've had some, actually I should backtrack. We've been averaging between 8 and 12 deaths every day. We have had announce some big numbers recently because we're updating for a couple days at a time. But we have been averaging about 8 to 12 deaths a day. We were on a slight decline. We are seeing a decline with regards to hospitalizations, ICUs, and ventilator usage, so that will indicate to us in the future that we should see a decline in deaths. We do not have the latest 2 days of data, and that really is going to be telling, is to tell us whether we're headed back in the right direction or not. So until I get that data, I can't really answer it other than saying we were declining, but we've also been averaging in the recent period. The nice thing is, though, and this is where it's very important, is we have seen up until the day we had the last data that hospitalization discharges were exceeding admissions. So there were more people that were being discharged as compared to those that were going to hospitals. And the less we can keep that hospital figure, the lower the deaths will in all likelihood be in the long run. We are concerned about the nursing homes because of the impact that a COVID outbreak could have in a nursing home. And I have talked to Lieutenant Governor and others. And remember, the Lieutenant Governor is going to be responsible as well for working with us to make a recommendation as to whether or not we can open that nursing home deaths that should not necessarily impact us differently than just general population deaths if we know of a known outbreak. So that's all going to be part of the calculus.
And so in regard to the lack of state data, in terms of your daily updates on confirmed cases and deaths, for 3 of the last 6 days, we haven't received any county update regarding those figures. Is that primarily either on the COVID tracker or on social media? Is that primarily due to the lack of available information coming timely from the state, or why is that information not being updated daily?
It's a combo. It was also an issue with regards to our own internal analysis, and they wanted to confirm the data. So all I can say is we're going to put data out when it's accurate. We don't want to put data out that's inaccurate. And so some of it's a delay from the state. Others, it's also just because we were questioning some of the data and we wanted to confirm it. So I'd rather announce it at 9 o'clock in the morning than 7 o'clock the night before and have 7 o'clock the night before be wrong.
And so are those problems resolved now?
I think so.
Okay, thank you.
Sandy, we're always checking the data. I mean, we're always receiving data from the state, and sometimes there are repeat tests on a person, so it's not an individual. That multiple tests is not in just one individual, so we have to account for that. Sometimes the addresses are wrong, or sometimes the person is identified with their address as being Erie County, and they're not an Erie County resident. So just because that it comes to us doesn't mean it is a unique case in Erie County. So we have to check that because we want to make sure that the data that we provide you is completely accurate. And that takes some time.
Yeah, I mean, there are individuals that have a mailing address that could be an Erie County community. Like if you live in Yorkshire in Cattaraugus County, you may have a mailing address that's Sardinia in Erie County. So a lot of that has to be confirmed, and sometimes there's some discrepancies that cause the data to just not be released immediately. Final question to Ethan Powers. You have any more?
Hey, Mark, all set for today. Thanks.
Okay.
Have a great Mother's Day, everybody.
Thank you, and that leads us to our finale, which is once again, Happy Mother's Day to all the moms out there. Hope you have a great Mother's Day. To all the sons and daughters out there, grandsons and daughters looking to see their grandparents, please do it in a smart manner. Please do it in a socially distant manner. As I said, the worst gift you could give your mother or grandmother on Mother's Day is the coronavirus. So just because you think you're feeling great, there are asymptomatic transmitters out there. People who have the illness don't realize it. So unless you know you definitely don't have it, you should really be careful and celebrate Mother's Day in the best way that you can for your mother, which is to make certain that she's healthy. So to all the moms out there, including my mom, Jan Polenkars, I hope you have a wonderful Mother's Day. Until we see you again, everyone, be safe and be well. Take care.
Happy Mother's Day!